I wanted to bring today's episode to the podcast talking about multiple sclerosis, MS, and really what you can do when you're on the fertility journey. So excited for you to listen to today's episode, really having you look at the diagnosis of MS completely differently from a functional standpoint. And then if you do have MS and you're on the fertility journey, what you can look at differently to help improve the chances of pregnancy success. Excited for you to listen. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step with anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today, I'm welcoming Dr. Terry Jacklin to the podcast, and we're digging into multiple sclerosis and being on the fertility journey. Terry is a licensed naturopathic doctor, certified in functional medicine, and also holds a certificate in mind-body medicine from Harvard. She's over 20 years in private practice and has come to specialize in more complex chronic health conditions such as MS. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Terry, excited to have you on the podcast.
Well, thank you, Sarah. I'm super excited to be here.
Great. Well, yeah, we actually, in a small world here where somehow we ended up in the same mastermind, and you were my doctor, my naturopath, like many years ago.
Years
when
ago,
I lived in a small town in Waterdown. And then all of a sudden I'm like, is that Dr. Terry? So yeah, it was kind of like this weird kind of full circle thing going on. So
exactly. And so, it's awesome to reconnect with you.
Yeah.
So,
awesome. So,
on a different plane, right?
That's right. So yeah, so could you share your journey and really how you came to do this work with us?
Oh boy, that's a really long story. Sarah, I've had multiple sclerosis for 36 years now. So I came to it obviously through my own journey, which started when I was 23 years old. And like I said, we could spend our whole time today talking about my story, but I'll just give you some of the key influencers in my story. And I think the biggest one was my neurologist at the time, who didn't hook me into that, MRI every 6 months. You got to get on medication right now. He basically said, apparently my picture was so grave. He kind of told me to run along and have a good life, and so I did. And because I think I didn't get hooked in that, it just, I just embraced the whole thing with wide-eyed wonder, so curiosity and always learning, and not saying it was always pretty, but it was more of a hopeful journey than going and sitting in a neurologist's office every 6 months to say, oh, you're getting better or you're getting worse, which is actually kind of irrelevant when you look at those MRI scans. So, I've had many ups, I've had many downs, and the biggest part is just about continuing to participate and to live and love life,
Mm-hmm. And you came to the naturopathic profession there kind of through your journey with this.
I guess I did. You're asking me to really reflect on my life. It was funny. One of the things that happened very quickly when I was diagnosed is people started calling me. I mean, I worked in public relations at the time, and all these people were phoning me to find out what they should do for their MS. So it's sort of like, and I mean, from all over the province, and, the old, my father's sister's cousin's nephew's brother told me to call you. Mm-hmm. And so, I guess I finally made an honest woman of myself and went back to school.
And so, well, first of all, let's talk about what is multiple sclerosis. And so someone that's on the fertility journey, mm-hmm. why is that important to mm-hmm. consider looking at that, and maybe why you're having a hard time trying to conceive?
Absolutely. Well, and it's interesting, and I'm so grateful that you've invited me on your podcast, because I get the fertility question all the time, because MS is it's considered an autoimmune condition, although it's arguably a lot more than that. That usually hits people in their prime reproductive years. Mm-hmm. So that automatically becomes a big question. Oh my God, am I going to be able to have babies? Really? But at the bottom, the bottom line, I like to cut to the bottom line, is we've got a misdirected immune system, or we've got a misdirected immune response that causes inflammation that is directed toward the brain. And that's exactly what happens in multiple sclerosis. So you can imagine from a fertility perspective that inflammation doesn't just impact your brain. That just happens to be where it's directed in multiple sclerosis, but potentially that could also be affecting one's fertility, right?
So let's talk about the like you had where that difference between the conventional and the functional, or alternative, integrative, whatever approach you want to say there. What's the difference of the treatment protocols that you see?
Sure. So I am absolutely a traditional naturopathic doctor. So and for the last 8 years, I've also been certified in functional medicine. So functional medicine is an interesting mirror to sort of a lot of principles that naturopathic doctors have held dear for decades and decades, hundreds of years in some case. And once again, to the bottom line, it's about treating the root cause of something. And I know that's almost become a buzzword nowadays, but it's true, right? The symptom is simply a message from the body that says, hey, something's going on here. You need to look more deeply into this. And, for example, infertility could be caused by inflammation in the gut.
Yeah. Like the gut we've done all kinds of podcasts about gut health and the importance of this. And I think people on the fertility journey, they're literally like, what, a parasite, a bacterial infection, fungal infection. No one even thinks to look in the gut when you've got this diagnosis that, oh my goodness, you're going to struggle to conceive.
Oh, absolutely. And, in naturopathic medicine, and now fast forward to the new science, which would include that functional medicine model, the gut has been held as central to good health of all kind for hundreds of years. And if you get into more traditional, like traditional Chinese medicine or Ayurvedic medicine, thousands of years. So yay for science for being here to pick up on what we've known in some cases for thousands of years.
And so, and we've talked a lot about on the podcast about food sensitivities. We have, in our Fab Fertile Method, we have couples start the elimination diet and then tweak it with food sensitivity testing. And many people that come to see us, they've already potentially made some dietary changes. Maybe they've, tinkered with gluten, maybe they've taken out dairy. So for MS, why is it important to look at potential food sensitivities? What are some themes that you're seeing?
Right.
Clients, patients?
Yeah. Well, first of all, I just wanted to share with you, when I first started to practice, I got really, really excited when I thought I decoded for, infertility. Right. And guess what I did? Took them off gluten.
Yeah.
Right. So it's so true. Right. We know that food sensitivities are at the foundation for that permeable gut, or what we call leaky gut now. And leaky gut is simply what leads to that inflammation on the other side of the gut into the rest of the body. So food sensitivities are about the inflammation that causes all the destruction wherever it be in the body.
Yeah, we see a lot of that non-celiac gluten sensitivity. So that was the case for me. So, diagnosed with premature ovarian insufficiency at 28.
Right.
Went on to have both my kids with donor eggs, and then discovered food sensitivities, gut infections, chronic stress. And for me, like gluten is just a firestorm on my body. And now, like at the time, I wouldn't even have said I had any, because people say, oh, I don't have any issues. I don't have the digestive. I have nothing. Like
it doesn't matter.
I had like skin issues. Now, when if I inadvertently somehow get gluten, it's like goes into like, I feel like I got a carpal tunnel thing going on. I got a blinding headache. So it changes over time. So I guess from an MS standpoint, like what do you see there? Like for
Oh, same sort of thing, like just an aggravation of symptoms, right? It could be, like you said, joint stuff. It could be heaviness in the legs. I know a lot of people with MS, like they just feel like they're carrying a sack of potatoes around with them when they eat gluten. And the important thing to understand is that you can't just eat a little bit of gluten and think you're going to feel the benefits. It's kind of an all or nothing thing. And Alessio Fasano, of course, is my favorite science crush and like the ultimate gluten researcher. He's got some great videos on YouTube if your listeners want to go and look at him. And basically, it comes back to the elimination diet, right? You got to go full gusto, take it out of your diet for 3 or 4 weeks, and then reintroduce it. And I use the analogy of a bucket of muddy water. So if you're throwing a handful of mud into a bucket of muddy water, you don't really notice it, right? So if you're eating a standard American diet and you keep eating gluten, you just don't even notice it. But when you clean that bucket of water up and you've got a bucket of crystal clear water and you throw a handful of mud in it, it's like, oh, you really notice it, right? And the same could be said about foods. You have to go off them and then reintroduce them one at a time. You guys do elimination diets all the time, right?
Yeah, it's interesting with that piece of like sometimes people are like, oh, I cheat. And like,
yeah.
And then it's creating that immune reaction in your body for like, weeks, months, or sometimes years.
And you know what? I've had patients, Sarah, that say, they get on the path and they start experiencing good things because we're doing good things with them. And then they say, yeah, no, I've plateaued. I'm not doing, you know what? I'm not getting any better. And it's really, so tell me about how you're eating. Well, I am perfect Monday to Friday, but I allow myself, like it's an option, I allow myself to eat whatever I want on the weekends. It's like, okay, so let's change that and see if this plateau lifts, and of course it always does, right? So, the cleaner your body gets, the better it functions, the more the littlest bit of nutritional dirt will set it back.
Yeah, absolutely. It's interesting with those little crumbs, right? And even if it's like we're seeing that it's when we're doing food sensitivity testing, and food sensitivity testing, it's like a snapshot in time. There's no perfect food sensitivity
of course.
test.
Yeah.
But it's like off the chart. So we're saying, okay, the whole household has to go gluten-free. That's why we're coaching couples. And then because many times the male partner, supportive, willing to make the changes, but then he's still potentially eating that standard Western diet. And so now he's starting to make the changes. He does the elimination diet. He realizes that, oh, wait a minute. Okay. I didn't know some of these seemingly unrelated symptoms. He starts to feel amazing.
Right.
And then they're together with it.
Yeah. I heard an interesting thing on the CBC one day on the way to work. And these are the things that caused me to come to a screeching halt at the side of the road and say, did anybody else hear that? And it was a researcher who was sharing the results of his research, and be darned if I can remember who the researcher was. But he said that in our culture, currently in our modern culture, 50% of women over 25 years old and 100% of women over 40 are gluten intolerant.
There you go.
Right. Yeah. So that doesn't mean you have to break out in big full body hives or, have diarrhea for 6 months at a time. It's just, it's messing up your system.
Yeah,
right?
Exactly. So take it out. I know.
That's right.
It's interesting with my group of girlfriends as, I'm like 51, and as they, like, I started eating this way probably like, I don't know, 10 or 12 years ago. And I'd go to the potluck and I'd go there and there'd be nothing to eat. I'd be like, okay, like bring my own food.
Exactly.
And now everyone's like, well, I'm dairy free, I'm gluten free, I'm paleo, and I can actually eat stuff at the potluck because I don't know if it's, obviously now with allergens kind of a little bit more popular, or there's, there's more variety. And then also people, I think, realizing the connection with what they eat and their health.
For sure. People are sick of feeling sick. So they're looking for more answers, right?
It's still people will default to the conventional side of things. So when you see like people, like when are they coming to you for, is it like people that are been just diagnosed, or do you find that they kind of come a little bit later? They've gone down that conventional path. Like, what are you seeing?
And that's a great question. And that's something I keep trying to determine for myself. So I get really gregarious, newly diagnosed people who know that they're absolutely not going to follow a conventional path, and that's fine. Or I get people that are 1, 2, 3, 5 years in who have kind of, it's kind of been sitting with them, and they really don't want to just sit back and wait to take new and different drugs. They want to participate in their life. They want to be proactive, which is something our current medical model can't provide. And then even sometimes I have people that have been diagnosed for years, like myself, and say, hey, there's just so much new stuff out there that I can't afford not to participate.
Mm-hmm.
Right.
And so what are you seeing with sort of the next couple questions here about heavy metals and infections? I guess we'll start with heavy metals. And what are you seeing with people with MS, with your patients?
Well, I think heavy metals is really, just like chronic infections, are an issue for anybody who's got any chronic inflammatory condition, right? Heavy metals like fillings, amalgam fillings in the mouth have been connected with multiple sclerosis since I was diagnosed in 1985. In fact, that was probably one of the big first discoveries that I made, was a book on how, amalgam fillings impact the central nervous system. But I'm going to forfeit the metal discussion for the infection discussion, Sarah, because I think, to me, that's totally, that just relates to everybody, because we have infections that our medical model doesn't understand the concept of latent chronic infection. They are there to treat acute infection, right? High fever, really sick, antibiotics, bring it down, right away into the sunset. But what we've got with a lot of autoimmune or inflammatory conditions is this low, slow churning of that immune response, because there's what's called a subclinical infection going on. And remember, I said it's the misdirected immune response in multiple sclerosis that's playing itself out in the brain. In someone with Hashimoto's, that misdirected immune response is playing itself out in the thyroid, or it's playing itself out in the gut, or in the joints with lupus. So those infections are very, very common, like Epstein-Barr virus, direct connection to multiple sclerosis, but also other autoimmune conditions, right? And we've all been exposed to somebody with mono, and Epstein-Barr is one of those ones that you can actually have high titers, but nobody thinks to test them, But other infections that are directly connected to multiple sclerosis are the herpes family of viruses and different bacterias, like chlamydia pneumoniae or mycoplasma pneumoniae, which are upper respiratory tract infections. So anybody who's got a history of recurrent bronchitis or recurrent sinusitis, the sinuses are a great little snuggly, warm, protected place for infections to hang out, right? So this is when we've got to think of these ongoing things. I've just been working with a young lady recently who's had sinusitis all her life. And honestly, I started something ridiculously simple, which is a nasal spray with her. And within 2 days of using it, she started to feel better. Like her drag down, knockout fatigue from MS had started to improve. And it surprised me too, I've got to say, but she's always had these sinuses,
Yeah, that's sinusitis. That's something I had for years, where it was like, oh my goodness, I had literally every cold went to a sinus infection. I thought it was a great idea to take antibiotics for like years of this stuff. It just completely destroyed my gut. Then it went into bladder infections and
Oh yeah,
infections, and then all these different gut infections because the terrain of my body had just been,
exactly.
the gut had been destroyed by all these antibiotics. And then also I was on hormonal birth control for years.
Oh yeah, beautiful.
And obliterated it all. Yeah. So it was, so that's interesting. Okay. So with the EBV then for the Epstein-Barr virus, that you're seeing that connection there too. And then so and herpes and the respiratory sinus, anything else you're seeing?
Those are the main ones. Of course, Lyme. I mean, we live in an endemic area here in Ontario,
right?
But there's lots of endemic areas with Lyme disease. So the bacteria that causes Lyme, Borrelia burgdorferi, but also what they call co-infections, are another set of bacteria that kind of hang out, with Borrelia and cause chronic infection. And of course, we know about Lyme disease because it makes people really, really sick. And there's actually there is actually sort of a group of people that don't believe that MS actually exists. They believe that it's Lyme disease. And I've been practicing for 20 years, and I would say done enough testing, to know that there is that definitely that Lyme subset. And it's something I always want to rule out, but it's not always there.
Mm-hmm. Okay. And so for the infections, then what are you, so like, as far as protocols and things that you're doing, what are you seeing as something that's working for you?
Well, I mean, first of all, the gut, right? The gut's got to be healed, and it's got to be moving, and it's got to be binding the toxins in the gut and moving them out, right? And then I really go based on the patient, as to what I use, whether we actually do some antimicrobials or antivirals, or whether we just continue to do terrain work, which can be as effective as doing like full on, I'm going to kill these bugs,
Yeah. So like when you're saying terrain work, like probiotics and seeing the gut with the prebiotics, or what are you doing?
I'm trained in biotherapeutic drainage. So I use a lot of biotherapeutic drainage, which basically changes the function of tissues at a cellular level. So, going in there and just reminding that tissue, hey, this is the way you're supposed to be behaving. And when you're changing the terrain, then it's not a hospitable place for those infections to hang out anymore, right? So,
and what does that entail then?
I use Unda drainage remedies. There's all kinds of different drainage remedies out there now, but those are the ones that I've just been trained on for like 25 years, and I know my way around well,
Okay. So, and then anything else you wanted to say on infections?
Let's see. They can take forever to clear, or they can begin to clear right away. Or just like the bucket of muddy water analogy I used, sometimes, you start to feel really well right away. And then there's a perceived setback, when really actually what's happening is your immune system is just starting to deal with those infections. And so it's working a little bit harder. But actually, another thing we should probably talk about here, Sarah, is mold, right? Because mold is so immunosuppressive that even if you're full of Lyme bacteria or Epstein-Barr or herpes viruses, it doesn't really matter as long as that immunosuppressive blanket of mold is and mycotoxins are going on. And I've just a really interesting story, something that's happened to me recently that I would love to share. And that is I didn't realize until I started treating people with mold and started to reflect for a moment, holy smokes, I've lived my entire life in moldy circumstances, right? A moldy basement in my parents' home, my first places, swing and single places were basement apartments, I remember we rented this little place in between places, and it was so moldy that we covered the vents with aluminum foil. And, you didn't think of it that at that time, you just wanted the smell to stay down, right? Well, now we know how immunosuppressive that is. So starting to eliminate that first, before you get into the treating the infections. Once I treated my mold, I started to get like crazy herpes lesions. I started to get every little thing got infected, like a hangnail would get infected and it would last forever. A nick from a kitchen knife would get like, did that on my thumb and I had this great big, huge, pussy mass in my thumb, like stuff that would normally come and go. And basically, the analogy I use is we've lifted that immunosuppression of mold, and my immune system is sputtering and coming back online, if that makes any sense. So it's not quite ready to fight all those infections. But now I know that, and I am with my own naturopath going after those infections. So, that mold has to go first. And that, once again, is through the gut. That's about binding it and eliminating it through the gut using binders like activated charcoal, green clay, that kind of thing. Chlorella.
Yeah. And that whole mold, like if you've had any kind of water damage or there's like leakage, I guess if you like actually see mold. I know in the last house we were in, our bedroom, the person before us, they had to keep the windows open all the time. And there was mold in there. Then my husband went in and ripped apart the whole wall.
Oh yeah.
Didn't quite wear the proper mask.
Oh no.
And he has major sinus issues. And I was like, oh man, I just think something crept in there.
Oh, for sure. And once again, it could have been, the immunosuppression impact of the mold is making whatever else is in there. It could be mold itself because, mold also loves those moist, warm places like the sinuses, but it could be something else that was in there that because the immune system can't deal with it anymore is aggravating him. Right.
Yeah, no, it's interesting. I've done a number of podcast episodes on mold, but yeah, having like a mold remediation person come in, because it's not about you ripping it out yourself, because then that
you could just aggravate. Oh, for sure. Yeah. It's funny. We had the tiniest little roof leak in our house, right in the kitchen, right behind the pantry, of course. Right. Mm-hmm. And we just sold our house recently and we know the people who bought it. And he mentioned to us that when they took the pantry out, the wall was covered with black mold. Right. Yeah. It's scary. It's, you would have never thought it because we caught that leak right away, fixed it all up, didn't think there was any problem. So, there again, I'd been living for years with mold.
Yeah. So what about the physical therapy side of this? I was in one of our masterminds there. I was fortunate enough to somehow, I don't know how I got in here. You should have been in there.
I know.
It's with Terry Walls. I ended up having a one-on-one with her, and she's sort of the like the walls, is it the walls method that she has? Mm-hmm. And so a lot of work with MS. And she was talking about that she would do like physical therapy for like 11 hours a day. And she was in a wheelchair and managed to get herself out of the wheelchair. You obviously know more of this than about, probably about her story than I do. And then she was just talking about, from a fertility standpoint, that she felt that she believed that there's an autoimmune component with the fertility side of things. So it was interesting. We were kind of talking about that piece. So what's your take on the physical therapy side of things? And like, what do you see for MS that's working?
Yeah. Well, I think that I call exercise or movement, because nobody likes the exercise word.
Right.
But I call movement the most important supplement for the brain. So not just to keep yourself strong through the basic rules of neuroplasticity, which are so prevalent nowadays. We know that repeated exercise keeps our brain recreating the neural pathways that are required to keep ourselves moving, right? But also to keep circulation going. So lymphatics, our bowels, keeping the bowels moving. Constipation is such a huge issue. And if you're not moving, your bowels aren't going to move either, so carrying oxygen to the brain and building just those, like the neurotrophic factors in the brain that keep the brain happy and healthy. So absolutely essential on every level. So, movement begets movement. It's one of the fundamental laws of physics, right? So, yeah, it's a non-negotiable. And, Terry did wonderful things. Not everybody has 11 hours a day to work out.
Right.
But she was determined, and look what she did, right? She was in a tilt recline wheelchair.
Yeah.
So it needs to absolutely be a part of a happy and healthy healing routine.
What do you what do you recommend for what is a movement protocol? What does that look like? It was different for each person, I'm assuming, but what do you like depending on where they are? Like what do you
Yeah, definitely. Yeah. And that's a really great question, because I have MS patients who are running marathons, and I have MS patients who can only move their eyes.
Right.
And I only have 2 patients like that. But I participated in a neuroplasticity study down at the University of Madison in Wisconsin. And it was all about movement. I learned so much from the neuroscientists down there about how important it is. But even those eye movements are so important, in training the body how to walk or how to keep walking. So I think some of the most important lesson for anybody to learn is it doesn't matter. It doesn't matter. Just do it. It doesn't matter if you're running the marathon, especially for people who used to be like that, who maybe can't do what they used to do and get discouraged, but just do something. But this is the one that really changed my life. The brain receives the stimulus, whether it's real or perceived.
Yeah.
Right. And that's neuroplasticity 101. So even if you can't do something for 20 minutes, do it for 5 minutes and sit and visualize that for the remaining 15 minutes. So because the body is getting that stimulus to, reroute the neural pathways that it needs to move. And we know that it can do that. That's just kind of, we understand that can be done.
You walk us through that. So it's like, okay, you can only do the 5 minutes, and then for the extra 15 minutes, then you would just like send energy like to your leg. Like what would you do?
Well, just literally visualize yourself doing that activity. So say the exercise is stepping up 1 step and back down. Just for example, right? So you do that. Maybe you do that 10 times, and then you get too weak and it gets sloppy, and you don't want those sloppy neural messages, right? Because that's not helpful in rewiring. So as soon as things start to get sloppy, you sit down, you can close your eyes if that's helpful, and then just literally visualize doing that step up, step down, step up, step down. And that stimulus to the brain actually activates the muscles in the legs that are doing the action. So, if I could, I would take a sabbatical right now and study nothing but the neuroplasticity of MS, because it's so encouraging. And, people need to understand that it's, once again, not a one-hit wonder. It's not like, oh, I did that, I tried that, it didn't work for me. It doesn't work like that. It's something that you've got to repeat and keep retraining that brain. Norman Deutsch has some great books on that. He's written 2. The Brain That Heals Itself. Sorry, I'm just looking. The Brain That Changes Itself, and The Brain's Way of Healing, Norman Deutsch. So he's got some 2 great resources for people that are wanting to capture that, the power of neuroplasticity in their movement.
Okay, great. And then, okay, so I saw you had a blog, and I think you talked about this before, but the belief piece. So obviously getting diagnosed with this can be devastating, right? And it hits younger, and, we're also talking about fertility as well. So this is something I include in my program, a mind body spirit approach to this, because if you don't believe it's going to work,
it won't.
You won't.
Yeah.
You'll self-sabotage yourself and you'll say, screw it.
Yeah.
And so to like, how do you, when you're hit with something like this, how do you get to that belief piece? What do you see is helping people?
Wow, that is a really great question. And once again, here we are in the era of understanding the mind-body connection very, very deeply and very, very scientifically. So this is not woo-woo, even though there have been people that have been talking about it since the 70s in North America, once again in traditional healing practices for thousands of years, right? How the beliefs create thoughts create emotions are felt. Every receptor, every tissue in our body has receptors for our emotions, so that creates a physical experience and that creates our reality, right? So where are the beliefs? Where do the beliefs come from? First of all, that's the first thing I try to address with people, and oftentimes they're not even theirs, right? They're beliefs that were just handed down to them by the authority figures in their lives. So yeah, really believing in yourself and in your body. I think one of the greatest things that we've forfeited in our modern medical model is the belief that our body can heal. Right? Without taking a pill or without taking an IV or without taking a needle. And, the body is an incredible creation. And if you leave it alone, who was it? Dr. Osler, after whom, so many hospitals are named. He said that the physician's greatest purpose is to entertain the patient until the body heals itself. So add to that the belief that it's going to heal, and it's always been there. I mean, we know the science of the placebo effect. And when I was a first-year naturopathic student, and you'll probably laugh when you hear this, one of our wonderful elders was up giving a very formal lecture about the placebo effect, and I just couldn't understand it. And I stood up and I said to him, why, if we know that 30% of the time a patient is going to get better if we trick them into believing that they'll get better, why aren't we just teaching them to believe? So that's it, right? It's about stepping into the power of the placebo effect, right?
Yeah, it's interesting. I'm reading Joe Dispenza's his work right now. Is it Supernatural, his book? And yeah, just talking about many people with chronic pain, all sorts of different health issues. And as they start to release some of this like stuck energy down in the it can be down in the lower region, like the sacral region, the reproductive regions, and you can let it come out.
Oh yeah.
And then you can actually access the greater power, your intuition, all of this piece, and let go of that you're holding on to.
Well, and in your case, in the fertility world, that root chakra, right? Oh my God, what is the most verklempt chakra in the Western world? It's that root chakra, right? So yes, we're talking about things that make people wiggle and squirm and uncomfortable, and get over it, folks. This world is an energetic place,
right?
Period. Right? So our bodies are energetic entities, period. So the sooner we can tap into that and believe in that, the better off we all are, I know,
because I work with so many like type A busy professionals. Let's go. Love the science, love the testing. Tell me about the infections, the food sensitivities. And then I'm like, you've also got to be into the other piece of you believing this is working, or trusting your intuition, or looking for the signs. And that I came to that stuff like way later. I was like, I want this stuff over here, the logical side of things. And so, I believe we're all intuitive, and being able to trust that piece, and things keep showing up, why are they? And that like deep knowing belief that like no one in a white coat can, know your body better, and to get into that knowing space.
it's, it comes down to that connection with the self, right? Mm-hmm. So I find, especially in that fertility age, right? Nobody's connected to their body. They're too busy making money and paying for their Mercedes and buying a house and clothing their kids or trying to clothe their kids, and it's not, I am well beyond menopause myself and have observed many women progress as they get older and wiser, right? And reconnecting with the body. And wouldn't it be nice if we could encourage those young fertility patients to, whoa, slow down. You're asking your body to create a miracle, literally. Can you give it some space? Mm-hmm. Can you connect with that concept of allowing your body to be fertile? Mm-hmm. Right? Like it's the stress response. And I mean, there's no person running from a saber-toothed tiger that's going to get pregnant. Mm-hmm. Right? Yeah. So just slowing down and connecting and prioritizing it.
Yeah. And the business of fertility, IVF, just, perpetuates that like panic, impatience. You had better go now or it's, game over, and completely not trusting yourself.
Exactly. Here, we've got the solution for you. You don't even have to think. We've got your egg count. We've got your, whatever else they test, So yeah, it's an interesting world we've created, right?
It is. I know I was listening to the radio the other day and I'm like, they have some fertility clinics around here and they're like, and we've expanded and we've got clinics all over the area, like 10, 12, like 20 new fertility clinics, and come in and we've got bargain basement prices. And I'm like, what the heck is going on? I'm like, what? Low prices, really high success rates, and we're expanding everywhere. Like, isn't this The Handmaid's Tale or some sort of comment on what's happening in our society? Like, what is going on? Yeah. And so do you have a success story? I'm sure you've got lots. Anything that kind of comes to mind that you would like to share with us?
I am thinking of one young lady that just pops into my mind. I mean, it happens very, very, very regularly that, people with mobility aids, whether it's a cane or a walker or a wheelchair, get rid of that kind of stuff, foggy heads clear, but I'm just thinking of a gal who was a marathon runner, and that's probably what triggered with me. And that was what she lived for, and all of a sudden she couldn't run anymore. Mm-hmm. And, she didn't look horrible, but she just couldn't run, and we took her through, I do a lot of self-care work. I do a lot of diet and nutrition. And then she particular had a big history of gut dysfunction and, just a wild and crazy history of antibiotic use, and fixed up her gut. And really, to me, that's super preliminary stuff, right? But that was enough to get her back in her running shoes and running again. Mm-hmm. So, it doesn't take a lot. It just takes the belief and the work. You've got to step up. You got to do it. Nobody's going to spoon feed you. You've got to want to do it. And when you're ready to do it, all kinds of stuff is possible,
Setting the intention and committing.
Absolutely. Yeah.
And so you have got a Facebook group called Transform MS Naturally. You go live in that group a lot. What can they expect if they join that group on Facebook?
Well, it's a private group, first of all, so you have to apply to get in. So we are looking for people who are committed, who are dedicated. A lot of people have already made changes in their world, and they just want to keep on building that, trying to stay away from the gloomy poo-poo Facebook, page dynamic. What they can expect is me, lots of me. And we just started the group. And I just want to teach. That's basically what I want to do. So we've had Facebook Lives on understanding exactly what MS is. We've had Facebook Lives on food and nutrition, on the gut microbiome, mind, body. So they can expect to learn, and they can expect to keep doing things the way it feels right for them, which is naturally.
Awesome. So that's transform MS naturally.
Mm-hmm.
And anything you wanted to, any final thoughts on this, Terry?
Oh, my final thoughts are, step up, show up, do the work. Life is grand, and there's a whole big, fat, hairy life beyond the diagnosis. So don't get hooked by, oh my God, I've got more lesions, or, that's really doesn't really matter when you're doing all the right things right. And like I said, there's a great, great life to be had beyond the diagnosis.
I love it. Thanks for sharing all your words of wisdom. I appreciate it.
No worries. It was great to be here, Sarah. Thanks.